If you've ever left a doctor's appointment feeling gaslit, misunderstood, or like you weren't taken seriously, I need you to listen closely because what I'm about to share could completely change how your next visit goes. Here's the truth that most doctors won't tell you. It's not that you're saying the wrong things. It's that the healthcare system rewards very specific communication patterns. And when you don't know these patterns, even the most legitimate pain can get overlooked or minimized. I'm Dr. Jacob Kneeman, board-certified pain medicine physician, and today I'm giving you the Insider Playbook. In this video, you'll learn the 5 phrases and scripts that make doctors sit up, listen, and take your pain seriously. And stick around until the end, because this kind of practical advocacy helps you feel more prepared and empowered. So please, hit that like button now and let's dive in. But before we get into the details of the scripts, I want to validate something you probably already know. The current healthcare system is broken in a lot of ways. Doctors are rushed, appointments are short, insurance creates barriers, and there's enormous pressure to move quickly. But here's what I've learned after thousands of patient visits. The patients who get the best care aren't necessarily the ones with the most or least amount of pain. They're the ones who communicate in a way that helps doctors quickly understand 3 things: what's wrong, how it's affecting your life, and what you need. When you can communicate these 3 things clearly and efficiently, everything changes. Doctors feel like they can help you. Insurance is more likely to approve treatments, and you walk out with an actual plan. Now, I know this might sound frustrating, like you're being asked to perform just to get basic care. And you're right, it shouldn't be this way. But until the system changes, I want to arm you with the tools that actually work right now. So let's go through these 5 scripts that will transform your next doctor's visit. The first and most powerful script is what I call the because statement. This is where you link your symptom directly to a functional limitation and then to a specific request. Here's the formula. Because of this symptom, I can't do this activity, so I'm asking for this tool or specific solution. Let me give you a real example from one of my patients. Instead of saying, "My back really hurts and it's been going on for months," she said, "Because my back pain wakes me up at 2 a.m. every night and I can't stand for more than 5 minutes, I'm asking if we can discuss an MRI or referral to a specialist, like a neurosurgeon." The first statement is vague. Doctors hear back hurts for months dozens of times per day. The second statement does 3 things instantly. It gives a specific symptom with the severity, shows functional impact, can't stand for 5 minutes or sleep well, and makes a clear, reasonable request, MRI or referral. This approach is validated by chronic pain patient advocacy research showing that because statements help establish credibility and create clear communication pathways. Here's why this works. Doctors are trained to think in terms of chief complaint, functional limitation, and treatment plan. When you speak our language, you make our jobs easier. And when you make doctors' jobs easier, they're more likely to advocate for you. Before your next appointment, write down one because statement. Practice it out loud so it feels natural. This one technique alone will change how doctors respond to you. The second script is what I call the 3 numbers framework. This gives doctors a snapshot of your situation in less than 10 seconds. Here are the 3 numbers you need: pain level out of 10, functional level, and goal. Here's how it sounds in practice. My pain is typically a 7 out of 10. I can only stand for about 5 minutes before I need to sit, and my goal is to be able to stand for 20 minutes so I can do my grocery shopping. Let me break this down to show you why this is so powerful. Pain level gives objective severity. Doctors document this in every note, and most insurance carriers require it. Functional level. This shows real-world impact, and this is also what insurance companies want to see. And finally, the goal. This demonstrates you have reasonable expectations. You're not asking to run marathons or be 100% pain-free. You just want to live your life and do normal, ordinary activities. Compare this strategy to, "My back hurts all the time and I can't do anything." That statement, while perhaps true, doesn't give the doctor actionable information. The 3 numbers framework gives them everything they need to document your case and justify the treatment. Chronic pain patient experiences show that providing specific, measurable functional limitations helps overcome the "you don't look sick" bias and establishes credibility. Write these three numbers on a note card and bring it with you. When the doctor asks, "So what brings you in today?" you can glance at your card and deliver this perfectly. I've had patients tell me this one technique made them feel so much more confident during their appointments. The third script is the timeline and triggers summary. This is a 30-second story that gives your doctor the clinical context they need. Here's the structure: when it started, what makes it worse, what makes it better, and how it's changed over time. Here's an example. This started 6 months ago after I lifted a heavy box. My back pain is worse in the morning and after sitting for more than 30 minutes. Walking in heat helped temporarily. Over the past month, it's gotten worse. Now I'm waking up at night, which never happened before. This is gold for doctors because it tells us the mechanism of injury, the pain pattern, relieving factors, worsening factors, and progression. In 30 seconds, you've given me enough information to start forming a differential diagnosis. Compare this strategy to, "It just hurts all the time. I don't know when it started." That doesn't give me anything to work with. Effective pain communication requires establishing a clear narrative that helps clinicians distinguish between mechanical, inflammatory, and neuropathic pain patterns. Here's something to consider. Before your appointment, write out your timeline on paper and include it when it started, the approximate date, or even just the trigger event, what makes it worse, such as the activities or times of the day, and what helps, even if it's temporary, and how it's changed, whether it's getting better, worse, or has changed recently. Bring this paper with you. It's okay to read from it during your appointment. Doctors actually appreciate when patients come prepared like this. It actually shows us that you're organized and you're serious about getting better. The fourth script is what I call the specific ask menu. This is where you make a clear, reasonable request for what you need next. The key word here is specific. Vague requests get vague responses. Here are some examples of specific asks that work. Based on these symptoms, do you think an MRI would be appropriate? Or would a referral to a physical therapist or a neurosurgeon make sense? Are there any imaging studies we should consider to rule out serious causes? What are the next steps if this treatment doesn't work in 4 to 6 weeks? Notice that all of these are framed as questions, not demands. They reference your symptoms, they suggest reasonable next steps, and they show you're thinking ahead. Compare this to, "I need you to fix this," or "I don't know what to do." Those statements don't give doctors any direction. The specific ask menu gives them options to work with. When patients make specific, informed requests, they're more likely to receive appropriate diagnostic workup and treatment referrals. Here's the insider secret. Most doctors actually want to help you, but they're constrained by time, insurance, and protocols. When you make a specific, reasonable ask, you make it easier for them to advocate for you within those constraints. Before your next appointment, consider researching 2 to 3 reasonable next steps for your condition. Write them down as questions. This shows you're informed without being demanding, and it gives your doctor a clear path forward. The fifth and final script is actually about bringing someone with you and having them use a very specific introduction. Here's what your advocate should say at the beginning of the appointment. "Hi, I'm so-and-so, patient's sister," for example. "I'm here to help summarize what's been happening and take notes. We've been keeping a log of symptoms over the past 2 weeks. Is it okay if I share that with you?" Let me tell you why this is so amazingly powerful for patients. First, it establishes the advocate's role immediately. They're not just moral support, they're an active participant. Second, it shows preparation. Third, it asks permission, which respects the doctor's authority. Research on chronic pain patient experiences show that many patients rely on advocates to help manage the emotional and cognitive load of medical appointments, especially when dealing with complex conditions. Here's what the advocate should do during the appointment. Take notes on what the doctor says, ask clarifying questions if something is unclear, gently redirect if the patient gets emotional or off track, summarize the plan at the end. As an example, "So just to confirm, we're doing X, Y, and Z, and we follow up in 4 weeks. I know bringing someone might feel like admitting you can't handle it alone, But here's the truth. The most successful patients I see are the ones who bring advocates. It's not a sign of weakness. It's a sign of wisdom. If you don't have someone who can come with you, here are alternatives. Ask if you can record the appointment on your phone. Most doctors will say yes. Request a visit summary in writing before you leave. Use a patient portal to send follow-up questions after the appointment. The key is you don't have to do this alone, and you shouldn't have to. I want to address something real, and I think it'll help for those painful conversations you have with your doctor or care team. Chronic pain is exhausting, as we know. It can be frustrating and emotionally overwhelming. If you get emotional during your appointment, if you cry, if your voice shakes, that's completely normal and valid. Chronic pain patients often experience emotional overload during appointments due to the combination of pain, medical trauma, and the pressure to perform correctly to be believed. But here's what I want you to know. You can acknowledge it and redirect. If you start crying, you can say, "I'm sorry, I'm getting emotional because this has been really hard. Let me take a breath and continue." Or you could try, "This is frustrating for me, but I want to make sure I explain what's happening." This does two things. It acknowledges your humanity. Doctors are human too. We get it. And it shows you're still in control and focused on communication. You don't have to be perfect, emotionless, like a robot, to deserve good care. You just need to communicate clearly when you can, and that's what these 5 scripts help you do. If you made it this far and you want a free script card, comment below saying so. I'll reply with a direct link. If you want to check out why I think that the pain scale is an outdated mode of measuring patients' experiences, please check out the next video in which I discuss why it is broken and what needs to be used instead. See you in the next video.